And also, now that we understand chronic stress, unhealed trauma, all of this has a huge impact on how we feel on the inside. Do you think that there should be equal number of therapists as many number of as there are surgeons?
Yes. So I think we have to help people with negative emotion.
Mm.
And allopathy is about doing surgeries and giving antibiotics and giving a quick fix or a curative procedure, right? That's what hospitals medicine is required. We need that.
Mm.
We need surgeries for fractures and broken bones and ruptured organs. We need antibiotics for life-threatening bacterial infections. But there's this whole other aspect of healthcare, which is chronic,
Mm.
long-term conditions, driven by negative emotions, driven by habits or pollutants or other things that are keeping us chronically sick. And there's a very different level of work that needs to be done there. On the contrary, more work, more people on the field, more feet on the ground.
Right. And also, do you believe because of your personal journey that you went through in 2013 and you had to go through a spiritual journey yourself, your understanding of this is way better? Let's take it two paths, right? One path, you never went on this journey, and the second path is the path that you're on. Do you think both the versions would have had the same level of awareness that you have right now?
Mm-mm.
No.
No. Without my own spiritual awakening, I don't think I could be the person I am today, because I had to break down so many beliefs in my head, so many attitudes, so much ego, arrogance, judgment. There was no space for a deeper wisdom to come, and I think the spiritual journey is you discover yourself, and through discovering yourself, you instantly realize it's same.
Mm.
There's just a degree on the wall, maybe, but we're two human beings in the room. If it's a doctor patient, we're just two human beings. But how will I have recognized the other if I've not recognized myself? So I don't think it would have been possible. I don't see how I could have.
Do you think the medical fraternity is now slightly opening up to conversations like these? Or is it still rigid?
In India, we're still able to ask these things to each other.
Okay.
I get shot down sometimes. It's like, you're asking for too much, or that's not possible, or my OPD is too busy. So people will agree. See, there's this word called cognitive dissonance, which is, I am uncomfortable when you say this to me because it's true, but it makes me so uncomfortable that it's easier for me to shut you down than process and go deeper.
Okay. The shutting you down is a result of me not being able to handle my discomfort.
It's uncomfortable.
Okay.
So easier to just push you away with your ideas is, oh, she's unconventional, or, oh, that's okay in your practice. I can't do that because I have such a busy practice. And they're not wrong. They're not wrong. They're right. So it's okay. I don't think this is everybody's journey, right? This is I don't want to judge anybody. I think we need those doctors doing what they are doing, because if I'm sick, I need them.
Yes.
Right? For the thing they are good at.
Yes.
So this is not a judgment, but everybody might be having their own purpose on earth, why they're here. For me, I don't see how I would have been any other version except this. And if anybody asks me to now lift myself and go be in some typical role where I have to do what I used to do 10 years ago, my hands would just be tied. I would just be like fully uncomfortable. I would be uncomfortable.
So now, do you believe the Indian healthcare system leans more towards prescribing medication rather than promoting healing?
Unfortunately, yes. I think traditionally we think of hospitals, or we think of busy clinics or OPDs. The sheer volume of numbers that we see. Just yesterday, one of my patients asked me that her hemoglobin A1C, which is the diabetes average number of 3 months glucose, was just above normal. So she was just into the diabetes range. And her liver doctor said, oh, it's okay. And she came back to me saying, why was he okay with that? I know I want to be below the pre-diabetes range. I want to be in the normal range.
What is the normal range?
Below 5.7.
Okay. And 5.7 is?
Is pre-diabetes starts.
Okay.
And 5.7 to 6.5 is considered pre-diabetes. 6.5 and above is diabetes.
Okay.
Hers was 6.7. So he said, oh, not too bad. Because she had come from a 9 or a 10 or something, and working with us for 3 months, she had brought it down. He said, you're doing something fantastic. Please keep doing what you're doing. She had a fatty liver, reversed it. So she was like, just because the fatty liver is gone and now the 6.7, why is he so comfortable?
Mm.
I want more better results for myself.
Mm.
So this comes to the point, she asked me that why did he say that?
Mm.
I said, Baba, you have to understand, you are the healthiest person in his waiting room right now. He has people waiting on the edge of liver failure,
Mm.
needing a transplant because their liver is so damaged from all these lifestyle, even not even alcohol anymore. It's just these carbohydrates and sugars that are causing most causes of liver failure now. He's putting out fires. He's in firefighting mode. These are good doctors. They want to help their patients, but they're up to here in severe, advanced disease.
Mm.
And doctors, unfortunately, allopathy as a field evolved from the reactive or the curative or the acute phase, which first used to be surgeries and antibiotics.
Mm.
That's how modern doctors came initially. Now diseases have changed. Now we have chronic diseases, non-communicable diseases, diabetes, obesity. There's no one-time fix. There's no quick pill. There's no quick one-time intervention by a surgeon. So there's no training on the preventive or on the healing side for any of this.
Mm.
Plus, if I read back into my training days, all my training was emphasized on pharmaceutical, drug based. There was no training time given to nutrition or the lifestyle. It wasn't part of my training.
Probably because back then there was not enough research done to understand the other. I mean,
No, the data was always there.
it was there.
Yeah. I'm 15 years out, but the knowledge that diabetes can be turned around through lifestyle changes has been there since before that. It's more known in the media now. In the lay audience is more aware, but the scientific audience has known about this.
Okay.
Yeah. So there are probably vested interests that keep the status quo, because we talked about the food industry selling us and marketing us things. Pharmaceutical industry is definitely benefiting from the status quo. Why would they want doctors investing in reducing prescriptions when stock markets are driven by pharma companies doing well? There's an obligation to shareholders. Pharma companies are not obligated to delivering health. They're obligated to deliver stock price improvements. So the medications, if they would cure you, then you would stop taking the medicine, right? So we talk about the obesity drug. We're being told you have to be on it for life.
Mm.
So the marketing to the doctors also when they go for these conferences. See, as an endocrinologist, we get called in. I'm no longer popular in that lecture circuit because I always talk about reducing medicine. But the degree of endocrinology is the highest degree in hormones and medications of diabetes and obesity. So we lecture to the MD medicine, to the GP audience. Oh, this is a good drug, right? So we're influencing thousands of prescribers. Those thousands of prescribers will prescribe it to their thousands and thousands of patients. So the pharma industry keeps that messaging that you need to be on this medicine for life. Obesity is a chronic disease. So we suppose go into these speaking events saying that it's a chronic disease, you need to be on the medicine for life.
It's because doctors like you are influenced by the
Yeah.
pharma
Yeah.
industries. Okay.
We're paid. We're given a car, we're given an iPad, we're given a gift, we're given a pen, we're given some treats. And we are, this is the psychological. So in the US, it's now, you're not supposed to give any kind of gifts and incentives to doctors because that's kind of like a bribe.
Mm.
In India, it's getting more caught now. So you're not supposed to accept gifts from the pharma industry. But there are still workarounds, and the interactions are always there. That let's have an event, we'll give you a professional fee, and so these things are. It plays on a human being's mind if you're paid for something,
Mm.
and you may like to tell yourself that no, I'll only give the lecture, but I won't let it influence my practicing habits and my prescribing habits. But science has shown that prescribing habits do change.
Okay.
So you may lecture on something, and very likely you're going to be affected, and you're going to prescribe. So the messaging to the medical audience is that these are chronic diseases. I had a doctor as a patient. Diabetes, kidney is on the edge of failing now from diabetes. She's a doctor herself. She was told you need to be on insulin, but her body was making insulin. She was told you have to be on insulin. Insulin is better than pills. She accepted the prescription. And she asked me, but now I'm supposed to be on lifelong insulin. Why are you taking away? I said, but it's the wrong treatment for you. Where have you even gotten better? So even as a doctor, she's not aware that healing was possible
Mhm.
or that reversing this was possible. She thought it's just inevitable that my kidney is going to go. It's a chronic and progressive disease. So the it's multiple reasons why the healing element is not there in allopathy.
Mm.
The training is not there. The reverse marketing is very strong, that it's a prescription based approach only. So and the volume of patients. These are like three huge reasons why we are where we are.
It's crazy.
It's a big problem.
I mean, for general people like us who wouldn't understand anything, who would just blindly trust a doctor with the medicines that they give. I mean, sometimes we're not even sure if the doctor actually knows the repercussions of the medicines.
Of the medicines or a wrong advice on diet. Now, although we're not trained in diet, we still give diet advice.
Mm.
So sometimes doctors give wrong diet advice because they've not studied it, they've not read the recent stuff. And my MBBS was I finished MBBS 24 years ago.
Mm.
Imagine I didn't read after that. What if I'm still telling you something from my MBBS days, which is how outdated now? Okay. And if I talk about physiology, that textbook I read 30 years ago, because MBBS is a 5-year program. 30 years ago, I studied something. And what if I've not revised my knowledge? I've forgotten, I've, heard something, influenced something. So doctors need to stay on their toes. So in my book, I actually have a section how to talk to your doctor,
Mm.
questions to ask your doctor, topic wise.
Mm.
In diabetes, under nutrition, what should you ask your doctor? Under this. Patients should be empowered, because otherwise, like you said, maybe the doctor hasn't read up on this.
Yeah.
Hopefully, your doctor is curious and respectful of your question and will go home and read and come back with a better answer tomorrow. And if they don't, and if they just expect that you should blindly give your health in their hands, but you might be on a wrong track, then maybe you reconsider whether your health needs to be with them, because you deserve your health.
And your entire approach of healthy eating was so refreshing for me because you're the first person who told me not to count calories.